that perhaps what it is that they're looking at is not really the wrinkle that's the problem, but the loss of soft tissue underneath, so that I can help them understand what can be done to give a very reconstructive and natural looking correction of a problem. So that my goal with patients is that each patient is treated individually, but also that people look at them and say, hey, what'd you do? You look great. Did you come from the spa? Have you had vacation? But not that they say, hey, where'd you get your eyes done?
Exactly. What is it most people want? Are they looking for the fountain of youth? They just don't want to show age marks anymore? Is that it?
In my practice, that's absolutely not the case.
Really?
What I'm finding mostly is that patients are very proud of the age that they've achieved,
right,
but that they're healthier, they feel better, they're living longer, they're working longer, and they don't want any aging appearance to be a distraction from what they can really provide and who they feel like inside.
Do you do this on men as well as women? I'm assuming you have an abundance of women patients, but what is your practice? How is it balanced out?
I do about 20% men.
Really?
Okay. And 80% are women.
Because I know that men, there's a reason for men, they'll go in and get facelifts. We've read this, we've heard this, because it's very important in their work, you know, their livelihood. Men who keep continuing to look younger, you know, they can work longer. I guess that's a good way to put it. Would it be the same for women? Are most of them in the workforce? Are they professionals and wanting to?
In my patient population, most of them are professionals and young mothers, or older professionals who are still remaining very vital in the workforce.
Now, of the procedures you do on the face, you do eyelids, you do brow lifts, you do neck lifts. How many full facelifts do you do?
Well, at this point, I'm doing a majority of neck and upper lids combined with a brow lift if necessary. But most of my patients are under the age of 65. And at 65 and younger, it's very common that the mid-face can be done instead of with a facelift, but with some injectable fillers. And we can get patients another 5 to 10 years before needing a major facelift, which is a much bigger surgery to recover from.
Absolutely. All right, let's talk about eyelid surgery. That's very common. Can make a big difference, can it? How complex is it? What do you do?
Well, it depends, again, on what the patient needs. And part of what I do in a consultation is to help the patient analyze what it is that's bothering them, and then also what's contributing to that, what they perceive as a deformity, which is usually just an aging appearance of the eyes. So, for instance, in the upper eyelids, patients often will come in complaining that they have excess skin in the upper lids. But what can contribute to that look is a descent of the eyebrows, which patients are often not aware of. But by elevating the eyebrows just in the office with my fingers, I can show them how their eyes open up. So not everybody who comes in for an eyelid procedure wants to have a brow lift, but it's important in the consultation that they understand exactly what's contributing to what's going on, so that we know whether it's an issue of excess skin in the eyelid or low-lying eyebrows or a combination of both. And in the lower eyelid, patients often complain of bagginess of the lower eyelid, and what we're finding really is that what makes the lower eyelid look baggy is often a loss of soft tissue around the upper portion of the cheek as the face ages.
On your face, where you talk, right?
So in this area here, that you can get a loss of volume, which makes the lid look baggy when it's not truly baggy, but the cheek has pulled away from the lid.
So what would you put a filler in the cheek?
So often we can put fillers in right along here that will last 6 months to a year, and that will fill out this area. That this is the area that's become hollow, but it can make the upper eyelid look baggier.
The brow lift,
the lower eyelid.
Right, the brow lift that you do, what is involved in that?
Well, the brow lift has gotten really slick, because when I was in training, we had to make an incision that went essentially across the top of the head from ear to ear and lift the brow that way. Now, with the use of more modern technology, we can make very small incisions and put a camera into the brow to do the surgery that we need to do through a small incision, but with the use of the camera. So it's a very slick operation now.
And are you not still pulling the brow back?
Yes, you are, but you're doing it through very small incisions. The key to the brow lift in terms of the risk to the patient are all the vessels and the nerves that are right above the eyebrow. And you can imagine that if you have an incision that's 2 centimeters big and it's up here, that it's a long distance to see those critical structures. But if you can put an instrument with a camera all the way down here, you can work through very small incisions.
Does it take a lot of practice to learn how to do that? I mean, that's very delicate, isn't
Yes.
it? How do you practice doing that?
Well, you practice doing that during your residencies.
Yeah.
And so when we do residency training, then we're working with attendings who are fully trained plastic surgeons or general surgeons, as during my general surgery residency, and they teach us how to do things.
That's very interesting indeed. The neck lift, that would be the next area. A lot of people complain about bagginess under the neck, right?
Yes.
That seems to happen with age, I guess. It's gravity pulling it down?
It absolutely is. All the soft tissues of the face descend with gravity, unless we spend our lives, doing headstands, and tissues loosen too. So it's very, very common that the muscle layer underneath the neck will separate, and that we get some excess fat and bands and softening of the jawline as the cheek fat comes down into the jowls.
Is that very difficult to correct?
It's actually not, again, as long as you pay attention to what's going on in any patient's particular face. And so it can be corrected through minimal incision surgery, where small incisions can be made behind the ears and also underneath the chin if necessary. And sculpting can be done in that area.
When you do these procedures, is there a lot of recuperative time on behalf of the patient? I mean, do they have to stay out of work for like a week or stay laid up? Or what?
Surgery has a recovery. And it's very important that patients plan appropriately to have this done.
Right. Because there is bruising, there is swelling.
There's bruising, there's swelling, and more than that, it's a surgical procedure and your body's recovering.
Right.
So a lot of patients experience post-operative fatigue along the lines of when you have a bad flu, and you'll feel awful for 4 days, and on the 5th day when your fever's broken, you get out of bed and you're totally exhausted after half an hour of activity. So it's very important that patients plan properly for their surgery so that they can recover well.
Very interesting. Well, the next segment that we want to talk about involves the non-surgical treatments that you use, the new surgical rejuvenation, I guess, procedures. That's the way we term it, non-surgical rejuvenation procedures. We'll look at that aspect of the doctor's practice when we come back in just a moment.
We have been watching the operations of an organization which is doing its part to keep America strong, and we've been learning from its leaders about what they're doing to help move our country forward. This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it is my honor to present this prestigious award to Dr. Elizabeth Lee of Berkeley, California, for the outstanding work that she is doing to help keep America strong. Dr. Lee, it's a pleasure to give this to you. Congratulations.
Thank you so much. I'm very pleased to have the opportunity to receive this award, and I have to say that nobody operates in a vacuum, and so to all of my teachers and to my family, I'm here today because they've helped me.
Very nicely put. Thank you.
Thank you.
Congratulations for earning the Keeping America Strong Award, which honors innovators and leaders like you who are the heartbeat of America.
If you'd like more information on Dr. Lee's practice, you can find it on the web. Her web address is www.artfulsurgery.com.
I'm William Shatner. Thanks for watching.